This is a comprehensive mobile medical unit which is loaded with lot of diagnostic devices. So it's not only about basic medication of primary care. It will also give medication in terms of non-communicable disease like diabetes, hypertension, cardiovascular disease, anemia, cervical cancer, breast cancer in women. And it will be particularly focused on when you take a mobile clinic into villages. We have always found that the closer you take these kind of health facilities, more women, children and elderly people can utilize it. This has been our Maharaj's constant endeavor when he discussed this entire plan initially, and we have loaded everything, and the van can also connect to any of the doctors across India for specialist consultation. So overall we expect this will impact nothing less than 7 to 8 lakh people will get access to good quality health care, and it's by far a very large expectation, and we are very aggressive in doing this.
Is there any further plan to introduce more such vehicles?
Maharajji and the TTADC officials are aggressively working out to bring in more and more healthcare. In the line there is an EICU plan which is in way. He is exploring some international designs to bring in faster way how to do this. As Maharajji said about the blood bank, that is one thing. Free dispensing of spectacles is another service for the people. School children will get benefited. Quality of work will get improved when your vision is corrected. As I told you, EICU will now actually be able to stabilize patients and keep them here only. So those kind of advanced technology and healthcare services are encouraged. But the larger vision Maharajji has is to make this into a healthcare tourism hub. Not only serve the people here, build economy around it. So it's a pretty 2-3 years long-term plan, but you're seeing that things are happening faster. Thank you.